Hey everyone, welcome in. We're a couple minutes out from starting, just letting everybody sign in. So hang tight and we'll get going in a couple of minutes here, all right? To everyone who's joining in right now, we're just going to get going in another minute here, just trying to give everybody enough time to log in. So sit tight and we'll get going in a second here.
All right, Stephen, looks like we're at noon. We got a good group here, so feel free to get started when you're ready.
All right, thanks, Kate. So my name here is Stephen Zingg. I am a physical therapist with Renew. I'm actually the clinic manager out at our Bridgeport location. A little bit about me before we get into the dry needling here. So I am born and raised in Saginaw. I went to Nouvelle there. I did my undergrad at Michigan State, and then I went to PT school at Central Michigan. Been with Renew for almost 4 years now. I was over at our State Street location for 3.5 years, and then I moved over to Bridgeport here at the beginning of 2021. So today I'm going to talk to you guys about dry needling. I know it's something that a lot of people may not know a lot about or may have heard of and want to learn more. So just kind of give you some basics behind what it does, the science behind it, what we use it for, and how it can help. So if you guys do have any questions at any point during the presentation, if you hit the Q&A button and you can submit it that way, and then we can get to all of those at the end of the presentation. All right. So what is dry needling? Like I said, I'm sure most people have heard of it before, maybe read or seen about it. So it is a technique that's done by a trained physical therapist. So there is a training that does need to be done. It's not just something that is taught in your regular PT school curriculum. And so what we do is we use a monofilament needle that is inserted into a muscle or tissue. And what we do this for is treatment of trigger points and pain relief in those muscle and tissues. And we're going to get into the science behind that all as we go here, but that's kind of the general idea. We put that needle into that specific tissue or muscle, and we try and get pain relief in that area. So what is going on when we put the needle into the tissue? So first thing is that we are reducing the tissue tension. So when we are putting that tissue into the muscle, it's actually creating what we call a lesion. And it's creating a stress reduction in that muscle or tissue. Part of that is improving the circulation to that area. So by bringing in more blood flow, we're helping to circulate that area with more of the blood and reduce the inflammation in the area, because as we bring blood into that area, we're also going to take some of that inflammation out and away. And this helps to normalize our normal physiological process. So when we are creating that lesion, we are going to replace injured tissues with new fresh tissue of the same type. So if we're putting it into a muscle, we're going to create that lesion, and then we're going to replace that lesion with new fresh muscle tissue. So that's the idea of why we're putting that needle in and what the effect of that is. So this is probably one of the biggest things when it comes to dry needling versus acupuncture. So people are always asking, what is the difference? So with dry needling, it is based on modern Western medicine. So looking at the combination of biology, chemistry, physics, how those all interact within the human body itself. It works well with our homeostatic response. And so what this is it's the process in which we keep our internal environment stable, regardless of the external conditions and changes that happen to our bodies. So in the case of dry needling, that external condition is the placement of the needle, and that helps to kind of trigger that response to normalize those muscle tissue. And then one thing with dry needling is we treat both symptomatic and non-symptomatic points. So we can put a needle right into a specific muscle that is, painful, sore, tight, whatever the case may be. But there are also other locations that we can put the needles to try and bring along that healing process as well. Whether it be along a nerve path, at the nerve root itself. So we don't just look at the specific area, we look at it from a whole body standpoint. As far as acupuncture goes, we do use that same monofilament needle. So the needle that I use, I actually got from an acupuncture site, but that's about the only similarity that we do have between the two. So acupuncture is based more on traditional Eastern or Chinese medicine. So it looks at the yin and yang, so the balance of the body. It looks at your qi, which they consider to be the healing power within your body, the meridians that flow through your body. So when they look at, acupuncture, they are trying to restore that qi that has been disrupted. And they have specific points that there are on the body that they will treat. So if you have, stomach issues or indigestion, there is a specific point that they would needle into to try and relieve that. So we look at more of that whole body system. We look at specific muscles as well as somewhere else along the nerve path, but we look at it more from a anatomical, physiological point. So we have that knowledge already kind of baked into us with our schooling, and then we're using the needling process to kind of almost speed up that healing process. So it's not something where we have to, take a year's worth of courses, because it's something that we are already familiar with. It's just this new technique that we are learning to add into our repertoire. So I want to talk a little bit about the course that I take. So it was called Integrative Dry Needling. And this is a really cool course because it combined a bunch of different models of dry needling into one approach. And so when they look at the dry needling, they base it on both peripheral and central principles. So with your nervous system, you have your central nervous system, which is essentially your brain and spinal cord. Then you also have your peripheral nervous system, which is the nerves that branch off of the spinal cord and go to the body, innervating muscle, bringing sensory information back. So with the model that they have, it looks at the peripheral nerves, so the specific muscles and tissue, but it also looks at, where that information comes back to. So that's more kind of that whole body treatment. We don't just look at the single muscle or tissue that we're trying to treat. And again, we don't look at just that single trigger point paradigm. So we look beyond just the specific injury or injured tissue. We actually look at the nerve roots and other muscles around it to see where there could be dysfunction. So looking at it from a systematic view, we're taking that whole body into consideration. And then one of the tools that they have actually developed is a quantitative analysis for the efficacy of treatment. So it's something that they have used where we can use it to look at someone and determine if this is something that would be beneficial. If there are specific sensitive areas or trigger points in the body, we assess those and people who are more sensitive in those areas are more likely to be someone who could benefit from a dry needling treatment. So the model that they use is what we look at as the 3 S's model. So, and it looks at how we can explain the various needle locations that we use throughout the body. So first off, we have symptomatic. So again, that's a specific local injury to a tissue. So we find a trigger point, for example, in your forearm, or in the calf, in the upper trap, wherever it may be, and we put a needle directly into that muscle or tissue. And that's more what people are familiar with, putting it right into that painful area. They also look at it segmentally. So each muscle is innervated by either a nerve or a group of nerves to help with that muscle firing. So all of those nerves do correspond back to a nerve root somewhere at the spinal cord. So depending on where that nerve comes out along the spine, in your cervical spine, in your thoracic spine, in the lumbar spine, there's a segment that corresponds to that nerve. So one example is your bicep muscle in your arm. That is innervated by a nerve that's called the musculocutaneous nerve. And so that nerve has roots at C5, C6, and C7 up in your cervical spine here. So if that is a muscle that is injured, affected, we can put needles right into that muscle itself, but we can also go back and look at where the innervation of that muscle is, and we can actually put needles at the C5, 6, and 7 levels to kind of go over those nerve root areas to try and help that healing process. So we're not actually going into the nerve itself, but the tissue around that nerve, which can help to loosen some of the tissue around it. And then again, we talk about looking at it from a systemic point of view. So there is a shared neurology, circulation, and physiology in the body that can't be separated. So there's all this overlap within the body. So as opposed to treating a single individual point, what we can do is look at what we call homeostatic points. So there are certain points that they have found throughout the body that tend to be more sensitive and tender than others, but also that correspond with certain nerve paths, certain nerve roots that they've found that can be really beneficial with certain areas. So, we'll have a little picture of a diagram that shows a few of them, but, even though you may be having shoulder pain out to the side here, they've found that there are certain points along the back or in front here that can actually help with that as well, instead of just putting it right into the specific injured area. So each of those S's has a corresponding trigger point that can be treated with the dry needling. So that's kind of the point that we look into as far as where our needle placement is going. So again, we talked about symptomatic, it's putting it right into that injured muscle itself. The paravertebral. So this diagram I have here is a map of what we call dermatomes. So essentially each segmental level there where the nerve comes out is going to directly correlate with a specific location on the body. So you can see right through here, you have all your thoracic spine that basically go straight out like that. But if you look up into the arm area here, you can see you have C4 coming through here, C5. So there are different nerves that are going to correspond to different levels within the body. So that's what we talk about with the paravertebral or the segmental needles. So if you're having issues in your forearm, for example, that's the C5 dermatome. So what we can do is go up to the C5 level of your cervical spine, and we would put a needle right into the muscle around that nerve root. So, and then we have our homeostatic points, which let me bring you to the next slide here. So this is the homeostatic points. A few of them have been cut off, but you can kind of see a few of the areas here. So this is where they did that study. They looked at, I think it was over 100 different points in the body. And what they found was there were a top 24 that were most consistently tender or sensitive with the patients that they were treating. So number one right here is the deep radial spot. And so that location is right here, right on the outer edge of your forearm here. And I would imagine if most of you kind of just dug your thumb into that spot right there, you would find it to be probably not the most comfortable. But these are our various homeostatic points. So again, we talk about if you're having pain, obviously in this forearm area, we would put a needle there. But if you're having pain further down into the wrist, if you're having hand pain, I've worked with patients who having just some soreness in their hand. I put a needle right into this deep radial spot, and within a matter of a minute or two, they said they didn't have that pain anymore. So just because they're having their pain in this location doesn't mean that's where we need to needle. And in fact, some places like that, we don't want to needle because of some other structures there as far as blood vessels and things like that. So there are various different points throughout here. And we kind of use that as a little bit of a guide. And you look into the calf here and into the hamstrings. So we definitely use that as a guide to help kind of look at where we can put different needles and looking over some of those nerve roots. So some of those either travel directly over a path of a nerve, or a couple of these up here at the spinal level itself look more at that nerve root as well. So they did find certain nerve roots to be more tender and sensitive than others. So it's a really good kind of tool that we use to look at certain ones. Even looking over at here, there are a couple of facial ones as well. And I've worked with some patients on doing facial needling for sinus headaches and things like that. So like I said, they found there to be 24 throughout the body, and it's really helped to be a good kind of base of where you can look at for different areas for needle placement outside of the specific injured area. So obviously, when we're doing dry needling, we want to take max amount of safety possible. So anytime you're doing a needling with a sharp needle like that, there are some different things that we want to make sure that we're taking care of to avoid. One of those is a pneumothorax. So that is when your chest wall is pierced and air enters into the pleural space, and this can result in a collapsed lung. So with the fine point needle like we have, if we are in the wrong location, we can pierce that chest wall. So one of the things that we do to make sure that we are not doing that is we are always making sure to angle our needles towards bone. So the most susceptible place for that to happen is in our mid-back. So we don't actually do any needles in the middle of our back, kind of between our shoulder blade area. Any needles that we're going to do in that shoulder blade area, we always try and make sure we define where that bone is and then work away from that chest wall. So we're always making sure that our needles are going towards that hard bony background, because they're not going to be able to actually go through the bone itself. It just that bone is nice and hard. It's a good place to make sure that's going to stop our needle from going any further. So we always take extra precaution in that area to make sure that we aren't going anywhere near that pleural space. And then kind of similar with the kidneys. So those are located between your T12 and L3 vertebrae. So when we are doing any needling along the lumbar spine in that area, we want to make sure that we aren't going so wide as to possibly hit one of those. So one of the things that we use to make sure that we're not getting into the pleural cavity or getting into those kidneys is we have our 1-to-1 and 2-to-2 rules. So for the 1-to-1 rule, that is in the thoracic spine, we are never going to use more than a 1-inch needle, and we are never going to go more than 1 finger width away from the spine. So in the spinous process itself, which is right down the middle of the spine. So as long as we are within those parameters, we are not going to be able to go far enough to actually do anything to that. And then we're also going to have that bony backdrop of the vertebrae that we're going to be needling towards. And then similarly with the 2 to 2 rule, that's for your lumbar spine. So you wouldn't use more than a 2-inch needle. You wouldn't go any further than 2 finger widths away from the spinous process in the middle of the spine. So again, we're always making sure we're being safe and we're needling in towards bone, because that we want that nice bony backdrop to prevent it from going any further. Syncope. So this is when you may get lightheaded, dizzy. If you have a full syncope episode, you would be passing out. So when we do the needling, we mentioned before how it does improve and increase circulation. So you're going to get a blood flow to certain areas. Now, this can cause a little bit of lightheadedness. So what I always do anytime with a patient I'm working with dry needling for the first time is after we've done the needling itself, I always have them just kind of relax in that position. And then once they sit up, just have them sit for a minute or 2 to make sure that they feel okay. I have had a couple of patients complain of feeling a little lightheaded, and so I just have them sit, I get them some water, usually resolves within a couple of minutes, but you always want to be cautious about that, especially with your first couple of times. And that can depend on the number of needles you do, the placement of the needles. So, you'll definitely want to take that into consideration. With the number of needles, your first time, you're not going to put, 30, 40 needles into someone. You want to do just a few just to see how they respond, and then kind of base your treatment going forward off of that response and how they tolerated it. Because if it's something where they're, getting those head rushes like that, it's something we want to make sure we're checking for. If you are on an anticoagulant, it's definitely something that we want to know about. Blood thinners, obviously, like I said, talking about increasing circulation. With the needles, there is a chance when we were putting it in that we can accidentally hit a blood vessel, a vein or a artery. This is not a traumatic thing or anything like that. It not super common, but it definitely happens. When you're on a blood thinner, though, obviously there's increased risk of bleeding. I've worked with plenty of patients who have been on blood thinners, and we have had a couple of instances where we hit an artery and they had a small little blood drop and cleaned it off and nothing resulted from it. So you are also, if you're on a anticoagulant, there is a chance that you could bruise a little bit more easily. Again, when we're putting the needle in, it's totally a normal response. So definitely something that you want to be aware of and make sure that you are telling the therapist that you're working with, because there are certain things that we can do. Whenever I'm needling, I always look, I'm looking for veins before I put the needle in, because if we can see it, obviously we're not going to try and go straight into it. But once you get into a little bit deeper tissue level, you don't have the vision to see where those are. So, but we always take as much precaution as we can. And again, with the bleeding like that, usually it is not a problem, but we always want to be aware to take the utmost caution that we can. And then with pregnancy, so there have not been any adverse effects shown in research to having dry needling done if you are pregnant. The instructor who did our course, he said when his wife was pregnant, he did a ton of dry needling with her in her 3rd trimester, and it made both of them happy because she was not complaining as much, and so he wasn't having as much of a headache. So it definitely can be done. Again, it's just one of those things where we want to be, have the utmost caution. Usually in the 1st trimester, we would avoid it just because of the development things going on there. But it is something that has been shown to help, especially a lot of pregnant women have issues with tight muscles in the back and the glute area. So it can definitely be effective, but it's always something that we want to be concerned with. So those are just a couple of safety things that we always look into. So a couple of myths about dry needling. So dry needling hurts. Typically, no. The needle itself, you usually do not feel go in. Now, when the needle is actually in the body, you may have a sensation in the muscle or tissue that we are working with, and that is completely normal, in fact, expected. So typically what we expect is to have kind of a deep, dull, achy pain in that muscle. That's usually a good response from us. Every once in a while, we will get a sharp pain here or there, and sometimes that is us hitting a blood vessel, maybe hitting a nerve, and what we do in that case is we just pull that needle back out and either redirect it or we just take it out completely. So, but the needle itself is painless. There is a guide tube that we use to place the needle in. That is usually what people feel. They feel the guide tube pressing against their skin. They don't actually feel the needle itself enter the body. So kind of similar with all the vaccination, everything going on right now. Almost everyone I've talked to said they didn't feel the needle going in when they were getting their vaccination. Same thing here. You very, very, very rarely do people actually feel that needle going into the skin, into the muscle. So another myth, all physical therapists can perform dry needling. So again, this is something that all therapists can have the ability to do, but it's not something that all therapists are trained in. So there is a training to be done to be able to do something like this. It's not just taught as part of our regular curriculum. So you know, if a therapist is doing it, you know, you can ask where they did their you know, their learning for the dry needling. And you know, they'll always tell you there's a course that they do, and there are a few different companies. Like I said, I did mine through IDN, Integrative Dry Needling, but there are a couple of different companies that do courses, and you know, they do various different types of courses as well. So, but there is courses to take to be able to do this practice as part of your treatment sessions. So, and then we talked earlier about dry needling and acupuncture. So, a lot of people see the needles and just say, "Oh, that must be the same thing." But again, like we talked about, the science behind it is completely different, and that's your biggest difference right there. Like I said, the needles are the same. Everything after that is completely different as far as where we are placing our needles, why we're placing them there, the effects that they have, what we're trying to accomplish with it. So beyond the needles, they're two totally different things. So we've talked a little bit about some of the benefits of dry needling, but just to go over that, accelerated healing. So I'm sure plenty of patients who have been to therapy before maybe had some manual therapy work done where we've done like massaging in certain areas. So the idea with the needle is this kind of speeds that process up. So if I can find a trigger point and I can kind of do a trigger point release or massage, that can take, you know, 5-10 minutes. If I do it with a needling, I can put the needle right into that trigger point, leave it in there for maybe not even a minute, pull that out, and that trigger point can be relaxed and released. So it's a much faster, you know, process of getting those trigger points released. And that's not always the case, but a lot of times you'll see that those be able to resolve a lot quicker than a standard manual therapy technique. Improve flexibility. So when those muscles are relaxing, they're becoming more flexible, they're able to move better, you're not as tight throughout the body. Increase circulation, again, bringing in that blood flow to those tissues. Pain management and relief. Again, with those fresh new tissues you're bringing in, patients usually get a lot of relief from the dry needling sessions themselves. Reduce inflammation along with that circulation. When we're bringing that blood flow in, we're also taking that inflammation out. And then tissue restoration, we talked about when we create that lesion, we are getting rid of old damaged tissue and bringing in that fresh new tissue. So trying to restore that. So what are some things that dry needling can help with? To be honest, quite a bit. A lot of your typical aches, pains, injuries, dry needling can be beneficial one way or other. So I've treated patients with low back pain. I've treated patients with neck pain, with headaches, and that's both tension headaches and sinus headaches. Shoulder pain, hip and knee pain, foot and ankle pain, elbow, wrist, hand, and then just general muscle tension, you know, spasms, cramps. So there really, you know, you've seen the diagram so far, there really is throughout the entire body. We can help with a lot of different types of injuries. So I want to go show a couple different pictures of different needling areas and techniques that done and can be done. So if we are looking up at this top left one here, so that is someone who's having needles down into the neck. So these ones right here are more into the segmental along the vertebrae there. These two orange ones are actually up into the upper trap muscle there. One that is frequently tight, that is this muscle here. Stress, working from home, bad posture, that muscle gets really tight. And so that insertion of it up in your neck here is a really good place for those needles. And then you can see these yellow ones here. So that is more going up into the base of your skull. So that's what we call our suboccipitals. That is where a lot of tension headaches. So if you're getting headaches that start kind of at the base of the skull area, a lot of that can be caused from those suboccipital muscles. So that is a great location to do those, to try and relieve the tension in those suboccipitals. Looking over at this one in the right-hand corner here. So again, these are the paravertebral ones. So this is looking at the thoracic spine. And you can see you have one on either side of the spine there, so that we're getting to both sides of the body. And then you can actually see with this one a little bit of the kind of the redness kind of right around each needle base there. And that's that increased blood flow that the needle brings into the area. So you can see the vascular changes right there already. And again, this is really great for mid-back pain there. And then this one here, this is actually one of our homeostatic points that we talked about. So this is what we call our superior cluneal trigger point. And the cluneal nerve runs right into this boxed area here. So we're not trying to hit the actual nerve itself. That typically gives us more of like a sharper pain. We don't necessarily want that, but the tissue in the area of that nerve path is more what we're trying to target. So anywhere from 1 to 3 needles kind of within that area. I've had really good success with patients with low back pain, hip pain, glute pain, needling into that area. So that's a really, really common one that I've used. And then this is actually from the course that I took. So that's me here in the middle. So looking at, again, kind of those mid-thoracic ones. Alicia, one of our therapists up in Midland, she is doing some of those suboccipital and neck needles with me. And I can tell you firsthand that it works fantastically. I had almost immediate improvement in my range of motion in my neck after having that done. I can definitely tell you that it works. It definitely helps. And then over here on the left, this is Kayla, another one of our therapists who does the needling. And she actually has the facial needles in. You can see a couple down below the chin, in her cheek area there, and then above her eyebrows. So that is really effective with, like I said, with sinus headaches, with tension headaches, even if you're having more of the headache along the side here. People who have issues with clenching, there are really tight muscles in your jaw area that we can needle into to try and relieve the tension in those. So it seems scary, you know, with having needles in your face like that. Again, I had it done. You don't feel a thing. I wasn't having a headache time, so I didn't have any relief from it, but there were a couple of kids in the course who did, and they said they felt almost immediate relief. And I've done this with a couple of patients, and they did have really good relief from it. So that brings us to some of the therapists who do the dry needling here. So Alicia, who is the managing partner at our Midland location. Jesse, who is the managing partner at our Tawas location. And then Kayla, who is a therapist and pelvic health specialist at Midland and our State Street Saginaw locations. So Kayla, Alicia, and I actually all took the IDN course together, and then Jesse took the IDN course as well. So he did the same training as us. So we offer it at those 4 locations, at Midland, at Tawas, at Saginaw State Street, and at Bridgeport. So and we've been doing it ever since we've taken that course. We've been working that into our treatment sessions. We've gotten really, really good benefits from it. We've seen great improvement, a lot of pain reduction. So I'm really happy that I took the course, and I've seen a big change since I've been able to kind of work that into my practice. So. And again, we talked about our Bridgeport, Midland, Tawas, and then our site on State Street, but we do have 16 other fabulous locations where we do our other therapy. I haven't talked to any of our therapists if there are any others who are interested in doing this, but I know it's something that we are definitely interested in growing and offering. So now I did want to do a quick demonstration just to show you guys how easy and painless this is to do. So I'm just going to do it right on myself here. So I am going to get out of sharing my screen. And then after I do this demonstration quick, I will answer any questions. So this right here is the needle. So you can see pretty thin. What I'm holding onto is just the base there. So all I'm going to do is I'm going to put that into my forearm. So I'm going to tilt my camera down here. So what we do is we have the guide tube, and I'm going to put the needle in the tube like that. And so what I'm going to put it in is I'm going to put it in one of my forearm muscles right here. So I want to feel for that muscle to make sure I'm in the right area. And that is a little tender right there. So all I'm going to do, I'm going to find that spot, put that there, and I'm just going to give a little tap. Okay. And then you can see that needle there. And then I'm just going to gently push that down. And there we go. So super simple, didn't feel a thing. I do have a little bit of an ache, so probably not a bad thing for me to be doing this right now. But, you know, like I said, no pain, don't feel it going in. And I, you know, typically I'd have my arm resting, but I'm able to show you guys here. So again, really simple. Again, no pain from that at all. Normally I let it sit there for, you know, 30 seconds or a minute. Sometimes when we go to pull it out, it feels a little kind of sticky. And so that's just something that I'll say, okay, we'll just leave it a little bit longer and we'll see how that does respond. I've had a couple where I've actually seen it kind of tighten up around the needle and I don't even bother trying to pull it out because I know it's not ready to release yet. And then, you know, come back in a minute or two and it's released. And then all we do is just nice and easy, pull it out. We have our container that we dispose of and then no bleeding there, so it all looks good. So it is really as quick and easy and painless as that. So, and again, I was doing that to myself here. So it is a pretty simple and pain-free process for the patient. They really don't feel the needle at all. It's just that deep muscle ache that we are trying to go for. So I do believe we have a few questions. So Kate, if we want to get to those. Kate, you there? All right, so I have a couple of the Q&As pulled up here. So one that I've seen a couple times is this covered by insurance? So currently in the state of Michigan, it is not covered by insurance. So that doesn't mean that we don't do it as part of our treatment, and it's not like it's something that we bill you for separately. So what we, Kate, you there?
Yes, I just lost my internet, but I'm back. So
Okay.
Are you ready for questions?
Yeah, go ahead. I just
All
pulled
right.
it up and I was going through a couple of them, but go ahead.
Sorry
I'll
about
let you
that.
fire
We
away.
do have
Nope.
we have like 12 questions. So which ones
Yeah.
did you go through just now?
I was just talking about the insurance one.
Okay, sounds good. We did have a couple that kind of go together on that one. So it
Okay.
was, is it eligible? Do I need a doctor's referral? And is it specifically covered by Medicare? So those kind of go together.
Yeah, so like I was saying, the insurance companies at this current time do not cover it. So, and we kind of work with that. And again, we don't bill you separately if it's part of your regular PT treatment. We do it and then we incorporate it into your treatment. But we do offer cash pay sessions. So that's something where you don't need a doctor's referral for. It's something where you come in, on your own, or well, we schedule it, but we discuss, what the issue is, and we don't just start sticking needles in you. We do an assessment and everything, and determine if that's something that would be beneficial for you. And that's something that we can just kind of schedule on our own. Right now, I've got a couple patients who are just coming in once a week for a half-hour session. I've got a couple patients who, like I said, I'm incorporating it into their treatment sessions. But when we're doing it as part of the actual physical therapy treatment sessions, billing doesn't cover it, but we don't charge extra for it. It's just considered part of your treatment. So.
We did just have another question come in too that's a little bit similar, and I'm not aware of any agreements we have like this, but they asked if we are taking VA patients or if we have any agreements with the VA.
I know a couple of our clinics do. I know Saginaw State Street does. I know Bridgeport does. And again, it's the same thing as with the Medicare, that it doesn't cover specifically the dry needling treatment, but we do incorporate it into your treatment sessions.
Okay, great. One person asked if dry needling can be used for nerve pain, specifically due to scar tissue.
Yeah, so there are different actual techniques with the needle itself that we can use once it's in. They're a little bit more advanced techniques and usually wouldn't do them right away, but especially with scar tissue, what we can do is actually needle into that area and kind of just do a little, what we call pistoning, where we're just kind of coming in and out like that, or actually doing little circles in the area. And that can help to break that scar tissue up. And again, we're bringing in blood flow to help heal that. As far as the nerve pain, again, if we're looking at those different nerve roots along the spine or along those different nerve pathways, definitely can help with the nerve pain. I've done a few with patients who they were having some symptoms going down into their arm, and it, by the end of the session, they weren't having those ridiculous symptoms anymore. So it definitely can help with nerve pain.
A similar question, somebody asked about sciatic nerve pain and if this might be a good fit.
Yeah, again, that sciatic nerve is a little bit deeper just because of location in that glute area, but we do have longer needles for that. Again, we don't target the nerve specifically. We're not trying to needle into the nerve, but into the surrounding tissue, into the muscles. There's a muscle that goes right over top of it called your piriformis that is tight on, I can't tell you how many low back and sciatica patients that I see, that if we can get some relief into those areas, that should help to relieve some of those sciatica symptoms. Great.
It sounds like we might have somebody who's interested in the class for themselves. So they had a couple questions. How many classes are required? Is the cost of the needles included in the IDN class? And also, are you certified to do dry needling after that one course?
So the IDN that I did, it was a 3-day course. And it was an 8-hour day, or 24 hours total. So the needles that we used to do our training and our practicing was included in that course. But I bought my own separately after that course for the clinic here. The course itself was a introductory course. So as far as IDN goes, I am a trained IDN dry needling therapist. There is an advanced course that I will be taking, if not later this year, at the beginning of next year, depending on how things go. And then after the advanced course, then you would be a certified dry needling therapist. But with that first training, that introductory course, we have all of the skills and techniques to be able to do dry needling. The advanced course looks into a few more kind of advanced techniques, a little bit different areas of treating that are a little kind of trickier to get to. So, but as far as the kind of more basic techniques and areas, we are fully trained in that area.
Awesome. And we still have about 7 questions, so hang in
Okay.
there with me. Somebody asked about for sore arthritic joints, if dry needling would be good.
Sure. I mean, we don't needle directly into the joints themselves, but again, looking at bringing in blood flow to that area, trying to reduce inflammation in that area. A lot of times the arthritis can be aggravated by having tight muscles around that joint, so releasing some of those muscles. So the arthritis itself, not necessarily, but a lot of things that can cause or is caused by the arthritis can definitely be helped with the dry needling.
Excellent. And this is the last one that's condition specific, but somebody asked about herniated discs and dry needling.
Okay. Again, a lot of that with that tight muscle along the vertebral column there, that can be kind of exacerbating that herniation. Again, we're never going to needle into the discs themselves or anything like that. But again, it can be a tool, and that's really what dry needling is. It is a tool to further assist our treatment. So the treatment itself is great, but a lot of times we're using that as a part of our treatment. We also look at the strengthening, we look at other manual techniques. So we don't look at it as just a one-time fix. It's something that we incorporate into our treatment sessions. So, but it definitely can help to loosen the tissue around the spine there to that may be kind of keeping the herniated area restricted.
That sounds great. This one, I assume it varies per condition, but just somebody asked approximately how long the effects last after a dry needling session.
Sure. I've had patients who've, felt great for a day or two. I've had patients who've felt great, for over a week. The course that I took, the instructor said that he'll get patients in, once every 6 months, and kind of around that 5th month time, they start to get a little tighter, a little sore again, so they'll come back in. So it does vary, depending on, the dosage and the condition prior to coming in. There's a bunch of different factors that go into it. So there's not necessarily one, definite answer, but there, it's a range, and I've found that the kind of more we've done, the longer those effects seem to last for.
Excellent. This one's kind of an interesting question. He said that you've made a few references to they found and they say.
Yeah.
So who are they, and is there one kind of organization that's behind dry needling, or?
So this is from my experience with that integrated dry needling course. So there were a couple of therapists and a couple of physicians who kind of created this model, this IDN model. So they're the ones who are doing the research. I know Dr. Frank Gargano is one of the main guys who came up with the IDN model. So that's who I'm referring to when I say they're the ones who have done the research and come up with the model that I use in my practice.
And I'll add too, from the marketing side, I do some research on some of the different modalities that are used. And I've seen many peer-reviewed articles, just like any other, health treatment. I've seen a lot of that going on too. Somebody asked, just when you're determining if dry needling is a good fit for somebody, do you have like a certain procedure or assessment or things you take into account to help determine that?
Well, with that IDN, they did develop this tool that we use that, based on tenderness and sensitivity in certain areas, whether that might be something that can be beneficial. But just as a therapist, we are, always evaluating and assessing, every treatment session. And, I'm not just gonna, if a patient comes in for dry needling, I'm not just gonna start putting needles in them. I'm gonna evaluate the area. I'm going to feel for it, see if there's tissue tension in certain areas, ask them about, what type of symptoms that they have. So it is something that, I do a bit of an assessment before we actually get into the dry needling. So, and if there's someone who I don't necessarily would think from benefit from dry needling, I'll tell them that. If it's someone who just has a lot of weakness, I'll tell them that I think it's more of a weakness issue. I don't know if this is necessarily right for you. So I don't have any problem, turning someone away if I don't think it's the right treatment for them. So But I always do that assessment piece of it, and we kind of reassess each time as we go to make sure that we're improving and maintaining there. So
That's great. That's great feedback. This one is interesting. This one is almost like a trivia question, and I did look up the answer if you don't happen to know it.
oh boy.
But somebody asked how long dry needling in general has been in practice.
Ooh, that's a great question. I don't know if I have that answer.
Okay, well, I looked it up through the Dry Needling Institute that you went to, and they said it first started in the 1940s
Okay.
from Dr. Janet Travell, but then it was kind of further refined through the 1970s, and that's kind of the more modern treatment model. So,
Yep.
but I would say it's been out for, 50
Yep.
years.
And that's why that IDN talks about incorporating those different models. So, again, dating back as far as the 40s there, there have been a bunch of different views. Initially, it was just look at the specific trigger point and put a needle in there, and that's grown over time. So, that's where this IDN model is really nice, because it takes a look at everything that has been done so far and incorporates it into one model.
Excellent. And I'll give you a break and I'll answer the last question. But someone asked if they wanted to discuss their personal situation, what would they do? And we do offer 15-minute free screenings in all of our clinics. So whether you're interested in dry needling or just in general treatment, you can contact any of our clinics and set up that free 15-minute screening, nothing required from your doctor. And then you can kind of get some customized feedback there. So Stephen, if you have anything else to add, otherwise I do want to let everybody know that you'll receive a follow-up email that has Stephen's contact information if you have other questions, has some links to our dry needling clinics, and just a summary and access to the recording of this webinar too. But other than that, great information. Thank you for sharing.
Yeah, I'm happy everybody came. And like you said, if you have any questions, please feel free to reach out and I'll answer them as best as I can.
All right. Thank you, Stephen. Thanks for sharing
Absolutely.
everything.
Yeah,
Bye, everybody.
thanks, guys.